Welcome to the Center for Health Statistics webinar for County Partners on Vital Statistics. My name's Kathy Ellis, the Vital Records Trainer. In today's presentation, we will cover the dual purpose of vital records, what are vital statistics, the county role in vital statistics, the importance of confidentiality, the responsibilities of the statistics unit, the uses of vital statistics, publicly available data on the CHS website, which includes birth and death preliminary and final data, annual reports, and statistics dashboards. We'll also talk about data use agreements and other resources. Vital records serve a dual purpose. The first purpose of vital records is to serve as the legal record of a vital event. Oregon law requires that all vital events be recorded. Because of this, vital records are often the primary document used in establishing identity, citizenship, paternity, and in settling matters of estate after a death in the family. The other and equally important purpose of vital records is to serve as the primary data source on the health of our population. Vital records data sets are special and unique because they cover the entire population, since the law requires all vital events to be recorded. Not only is the event itself recorded, but a wealth of health, demographic, and geographic information is recorded along with it. Vital records are also used to affect public health outcomes and population health, not just to measure them. Programs like early hearing detection intervention, immunizations, home visiting, child support, etc., they rely on vital records data to administer their programs and improve health outcomes. Today's presentation will cover the statistical aspect of vital records. When news stories talk about deaths from cancer dropping or lower rates for teen pregnancy, that information is based on vital record statistics collected in Oregon and across the nation. The Center for Health Statistics is also responsible for compiling and analyzing the data from vital records. This data is used throughout the state and the nation for program planning and policy development, and is the primary data source used for measuring many Oregon benchmarks. It's also used to assess health equity among populations. Some of the most important information about the health of Oregonians comes from vital records, such as infant mortality, leading causes of death, low birth weight babies, emerging diseases, and mothers' access to prenatal care. These and the many other uses of vital records data are important, but we can't forget that these records are also the legal record of the event. Because they're used to establish identity, we must always protect the privacy and confidentiality of these records first. As a government agency, we follow federal regulations and state law requiring the protection of personally identifiable information and protected health information. Vital records are full of this personal and health information, and by law, any and all requests other than vital record certificates to eligible applicants or voter roll updates to the county clerk must be made to us here at CHS. We carefully review each request to ensure that confidentiality is maintained and that all applicable laws and rules are followed. The state registrar must approve any release of Oregon vital records data. Producing and publishing statistical information is the final stage of a long, ongoing process that begins with the prompt, accurate recording of vital events. Let's talk about the county registrar's important role in this process. Oregon has a statewide vital statistics system. This means the state registrar is responsible for ensuring that all laws and regulations are followed throughout the state. The county and state registrar work cooperatively to provide secure records and consistent service across the state. To support these goals, county registrars review death records for accuracy and completeness, following up on incomplete items as necessary so they can be registered. Some counties notarize acknowledgement of paternity forms, which are a part of the paternity statistics. County registrars facilitate issuance of certified copies of birth and death records. Also, the county registrars maintain the confidentiality and physical security of records. Your actions are key to safeguarding the legal sufficiency of the records that the statistics unit analyzes on behalf of our citizens. Vital events, births, deaths, marriage, divorce, chart the course Oregonians take throughout their lives. In today's complex society, using this information for careful policy and resource planning is becoming more important than ever. We greatly appreciate your partnership in this effort. Now I'd like to share a little about what the statistics program does. As vital records come in throughout the year, the statistics team reviews these records for quality and consistency. What statistics does is examine the records for information that seems out of line with other information on the record. For example, is the manner of death, whether it was natural or accidental, consistent with the cause of death, say cancer or a drug overdose? They also flag records with missing information or information that is way over or under what we normally see. For example, an 8-foot-tall mother. They then work with the registration team members to follow up on those records and confirm or correct the information. There are also soft and hard edits built into overs that help to ensure that the data that's entered is in line with the type of information being requested. The statistics program will then report the data to the National Center for Health Statistics so they can be analyzed on a national level. In addition to quality control, the statistics team also summarizes, analyzes, and publishes vital records data on a regular schedule in a variety of formats. As you can see on this slide, they publish data on births, deaths, fetal deaths, infant deaths, abortion, and marriage, Oregon registered domestic partnerships, divorce, and dissolution. They report this data to the National Center for Health Statistics. They also review data use requests. We're going to look at some of this published data, but first, I want to mention a few examples that show how vital statistics data are used in public health. One example is with opioid deaths. Local health departments and other researchers are using our death certificate data to monitor opioid deaths, where they occur, who died in terms of age and residence, and the characteristics surrounding the death. These data can reveal trends, which we can use to tailor interventions to be both more effective by understanding who the population is that we need to reach, and more efficient by targeting the areas in the state with the most problems. Another example is the state health assessment. Every 5 years, OHA produces a report on the health of our state and how Oregon compares to the rest of the country. It uses data from many sources, but vital records data is used to look at the impact of, among other things, chronic diseases, estimate rates for leading causes of death, and examine disparities in prenatal care. In addition to these local uses, all states send de-identified data to the National Center for Health Statistics, enabling similar analyses across the entire United States. Next, I'd like to talk about our publicly available data and reports. After that, I'll let you know how to request data that isn't publicly available. We already know that all requests for specific vital records data must come through the state office, but a lot of information is already posted on our website for free. We regularly publish and update data tables on birth, death, fetal death, abortion, and teen pregnancy on our website, which is free to the public. Since 2018, we've made that information available in data dashboards. This is the About Vital Statistics page. It can be accessed by clicking on the More Vital Statistics link from our home page. From this page, you can view the preliminary, year-to-date, and final data. You'll also be able to go to the various data visualizations like the data dashboards and data maps. The data maps are for the year 2017 and prior. Clicking on birth will take you to the preliminary year-to-date and final tables. These are updated quarterly. We wait 1 month before publishing to allow time for quality control and late records. Soon we'll have preliminary birth data dashboards. There are several categories such as age of mother, birth weight, and prenatal care. Click on a year within a category to display the information. The table can be downloaded as a PDF. Birth tables go back to 1998, and there's preliminary data for 2024. To view death reports, click on Deaths and then select from Preliminary Mortality or Preliminary Domicile Unknown. In the Final Death Data section, you can select Annual Trends, Leading Causes of Mortality, County Deaths, or Injury Deaths. All of this is information that will display as dashboards. On this preliminary death data dashboard, you can see total deaths by months. You can select a year with the current year being the default. Also, you can select the age, manner of death, or medical examiner view on this page. To take a snapshot of the data, click on the download icon on the lower right corner. All of the data dashboards that you see in this presentation have the option to download information by clicking on this icon. You can download as an image, a PDF, or a PowerPoint slide. Another preliminary death data dashboard is for Domicile Unknown, where you can see total deaths for unhoused decedents. Not all counties have Domicile Unknown decedents. This dashboard lists number of decedents by month and includes race and ethnicity, age, sex, manner, and place of death. One final death data dashboard is Leading Causes of Mortality. Select the year that you want the data for. You can also filter by leading cause of death, sex, age group, and race and ethnicity by clicking on the category option. There are similar filters on the other statistical dashboards. On the left side, you can also select for the population, whether it be for resident deaths or occurrence deaths, as well as measures like the crude death rate, median age, and years of potential life lost. Definitions and data notes are also available to view. You may be familiar with the annual reports where we published final yearly data. These were published from 1995 to 2017. The report had 2 volumes, Volume 1 for birth and Volume 2 for death. The report provided an extensive presentation of data, including narrative, graphs, and figures. These also go back to 1995 and can be downloaded from our website. Starting in 2018, the data from the annual reports was presented in online dashboards, which are more accessible and interactive. For death, there are a limited number of data tables for 2018 to 2022. We also have some historical reports from 1903 to 1918 that we've scanned and made available to the public. Oregon published its first Vital Statistics annual report in 1905. For over 100 years, the report was produced in hard copy format. In 2009, the Center for Health Statistics ceased production of paper copies of the report, instead offering it in downloadable form from our website. The annual report had evolved into several pages of narrative and dozens upon dozens of static data tables. The statistics dashboards rely less on narrative descriptions of the data and focus instead on presenting the data through interactive data visualizations. This allows for the examination of the data in new ways, focus on topics of interest, and allows easier comparisons to earlier data than was possible with static reports. There are several dashboards, and I recommend taking a look at all of them when you get the chance. For this presentation, I will focus on just two of them, the County Birth and Pregnancy Dashboard and the County Death Dashboard. To access the dashboards, go to the Vital Records website and click on Annual Reports in the View Vital Statistics column. Then scroll down to where the dashboards are located, and then click on the County Birth and Pregnancy Dashboard accordion. You can see that the dashboard covers data from 2010 through 2023 and includes several topics that are included on the dashboard. To open the dashboard, click on the Visit the Birth County Dashboard link. At the top of the dashboard, there are instructions about how to use the dashboard. So here are the instructions right at the top. We also have a couple of buttons that are for data notes, so you can click here for any data notes on the dashboard, as well as a button to click for definitions that are used on the dashboards. So I'll just close those up. Also on the dashboard, you have year information, so you select a year, and it's a drop down, so you just pick which year you're looking for, as well as selecting a topic. And there are quite a few different topics listed, like the age of the mother, race and ethnicity information, prenatal care information, low birth weight, tobacco use, and so on. So you just make your selection from the drop down, and I'm just going to leave age of mother there. So for this example, you can see the age of the moms when they gave birth, along with the percentages and the total number of births in each age category. You can see our age categories here. They're sorted by county in alphabetical order. You can also click on the ages column to sort from high to low. So I'll just click on an age column here, and you can see how it changes the sort when you click on it. Now, these are sorted by county in alphabetical order, so you can see the counties listed here on the left-hand side. And if you want to view information for just your county, you can click on it, the county from the left-hand side, or you can also click on it from the map. So I'll just choose Lane County here. And when you do that, then only the data for Lane County is displayed. And then if you want to go back to the full list for the entire state, just click on the county again. And you can see when you hover over the county, it also gives you some information about the percentage of statewide total as well as the resident births. So I'll just click on the county again, and then it will show me the full list. Now let's look at a different topic. Maybe you wanted to see a different year. So we click on the drop down arrow for the year. Let's look at 2020. And maybe you want to look at a different topic. For our topic, maybe we want to know unmarried mothers by age instead of all mothers by age. So if you click on that selection, then the dashboard will refresh, and now you're seeing all the unmarried moms by name. And again, you can see they are, you have your counties listed. You can also sort just like we did on the other topic, by clicking on the arrow in each column, and then you can sort. And if you wanted to see just your own county, just like we did on the other example, just click on your county here. So we'll select Deschutes this time, and you'll only see the information for Deschutes County. And again, to see the entire state, click on the county again, and the page will refresh and all of the county information will be listed. Next, let's talk about how to request information that isn't made public on our website. There are laws and rules that govern the release of data collected through Vital Records. The data we publish doesn't contain any personally identifiable information, but sometimes our partners need more specific information. For these requests, we follow ORS 432.350, which states that the state registrar may adopt rules permitting the disclosure of vital records and reports and related documents, data, or information if the disclosure is for public health purposes, or if the state registrar otherwise determines that the requester has a valid need for the information cannot be obtained from other sources, the requester is authorized to receive the information, and the integrity of the vital record or report can be assured. Let's talk about the process for requesting record level data. Just to be clear, when I say record level data, I'm talking about data for specific individuals. Imagine a spreadsheet where each row contains information on a single birth in your county. This is the opposite of summary data, which combines the record level data. State law and administrative rules govern the release and use of all record level data. The most specific guidance can be found in the OAR we've referenced on this slide. Data requests must be submitted in writing to the state registrar and must go through the state vital records office. So how are these requests handled? CHS has a research review committee that reviews all requests for data. The committee is made up of the analysts and manager in the statistics program and is chaired by the state registrar. The committee reviews all data requests to make sure they comply with the law, that they're being used for approved public health research activities, and that the security and confidentiality of the records will be protected. We often contact the requester to get more information about how the data will be used and protected, and it makes sure the data being requested is appropriate for the research question. Under the law, county vital records offices are not allowed to release vital records data even to local health officers. This includes unpublished summary data as well as individual records or working copies from OVERS. So as an example, a local public health officer comes in asking for copies of the death records to analyze cause of death trends. This seems like a reasonable request, but you're not able to release these records. You should have the health officer contact the state office. Another example, the district attorney comes in and wants to analyze infant deaths. As before, this is a good idea, but you can't provide the DA with the data. The district attorney would contact the state office. Data requests are made by completing an electronic form. We recommend that the program requesting the data should submit the form and not the county vital records staff on their behalf. There is a $60 per hour fee to prepare custom data requests. County health departments are exempt from this fee. I want to mention some other places that you can get vital records data. Some public, some semi-public. If you only need summary data for your county rather than individual records, you may be able to find it with the Oregon Public Health Assessment Tool. OFAT contains birth, death, fetal death, infant death, and abortion data, as well as population estimates and communicable disease data. It's interactive, so users can specify how the data is shown, by age, by race, by county, by cause of death, and play around with the different ways to display the data. It has data going back to the 1990s for birth and death. You must email them to set up an account. In addition, there are several divisions in OHA that are focused on specific topics. For example, the Injury and Violence Prevention Program has dedicated staff who monitor and report data on opioid deaths. This program also provides information for local child fatality review teams. There's also a maternal and child health program whose focus is just as its name implies. They're a good source of information on prenatal care, birth outcomes, and similar topics. You will also find PRAMS on their website, which stands for Pregnancy Risk Assessment and Monitoring System. It's an extensive survey of new parents and covers a lot more health topics than the birth record. So many requesters may find it more useful than birth data alone. The next national resource is CDC Wonder, which is an easy-to-use, menu-driven system that makes the information resources of the Center for Disease Control and Prevention available to public health professionals and the public at large. It provides access to a wide array of public health information like average age of mother, average birth weight, and cause of death. It's free to use with no login required, and you can get summary tables by year, county, age group, race and ethnicity, cause of death, or birth outcomes, and all sorts of other topics in any combination that you can think of. There's also some preliminary data depending on the topic that you select. In conclusion, we want to tell you how much we appreciate your taking time out of your busy day to learn more about the work we do in the statistics program. And we want to leave you with these 4 takeaways. The Center for Health Statistics is responsible for compiling, analyzing, and disseminating the data that we receive from vital records. Remember, the use and sharing of vital records are protected under Oregon laws. Statistical information can be found in published reports and data dashboards on the CHS website, and any request for vital record certificates, copies, or data must be referred to the State Vital Records Office for approval unless you're providing paid certified copies to eligible persons or providing notice to the county clerk for updating voter registration rolls. Thank you for listening to our presentation on the statistics program at the Center for Health Statistics.